Hi everyone, thank you for joining my presentation. My name is Jared O'Connor, and today we will be discussing bridging the bioterrorism preparedness gap in New Hampshire. As infectious disease outbreaks and pandemics are a constant threat worldwide, the shadow of bioterrorism also looms. Bioterrorism can be defined as the intentional threat or release of biological agents with the goal of causing disease or death among humans, agriculture, or livestock. These agents can be things like viruses, bacteria, fungi, and they're all released with the goal of accomplishing a social, economic, political, even religious objective to instill fear or panic among populations. Not only is bioterrorism a public health concern, but a national security one as well. The deliberate release of biological agents has the ability to cause large scale illness and death among populations, overwhelming healthcare systems, and causing disruptions in everyday life. Between 1970 and 2018, there were 31 worldwide attacks using biological agents, resulting in 9 deaths and 806 non fatal injuries. This highlights that while bioterrorism attacks are quite uncommon, events like these pose substantial consequences. So, a little historical context. The first recorded attack using a biological agent dates back to 6th century BC, where the Assyrian Empire contaminated the wells of their enemies with a fungus that would cause convulsions after ingesting. But in more recent times, modernized bioterrorism has included the 1984 Rajneeshi, apologies for my pronunciation, attacks in Oregon, where a cult group was trying to influence the outcome of a local election, so they contaminated salad bars with salmonella, leading to over 750 illnesses in the area. And then more deadly attacks include the 1995 Tokyo sarin attack, where a Japanese cult released a nerve agent into 3 separate subways, killing 14 and injuring hundreds more. And lastly, more notably, 1 week after the September 11th attacks in 2001, letters containing political messages and laced with anthrax were transported through the U.S. Postal Service. And as a result of this, 22 people were infected by the anthrax spores and 5 later died. So when we talk about bioterrorism agents, the CDC classifies them into 3 categories, A, B, and C, based on how easily they spread, how severe the disease is, and the level of public impact they can cause. So, beginning with category A agents, these include agents in the likes of anthrax, botulism, smallpox, plague, Ebola. They're considered the highest threat. They can spread easily, have a high fatality rate, and can create widespread panic and social disruption. Category B agents include Eastern and Western encephalomyelitis or Vibrio cholera, and they're a step below category A. They're moderately easy to spread and cause illness, but have lower fatality rates. However, they still require strong disease surveillance and systems to detect them. And then lastly, category C agents. These include multi-drug resistant tuberculosis, yellow fever. These are considered emerging threats. They can be engineered to spread widely and cause significant illness, which is why monitoring and research of these agents are just as important as category A and B. So leading into our discussion today, the COVID-19 pandemic revealed major gaps in global and national preparedness systems, gaps that are also relevant when we talk about bioterrorism. So strengthening preparedness means improving how we monitor zoonotic diseases, ensuring rapid genetic sequencing is available, and having the manufacturing infrastructure to produce medical countermeasures and vaccines quickly. Many of these same steps directly support bioterrorism readiness. Since an attack can happen anywhere and at any time, preparedness can't be a reactive item. It must be ongoing at all times. This means continuous investment in research, education, training, even policy development, and of course, disease surveillance. So while most would assume large cities are the main targets of a bioterrorism attack, smaller and less populated areas could actually serve as testing grounds for people with those ill intentions to assess the potential impact of a larger attack. And because of this, we will analyze how bioterrorism preparedness applies specifically to my home state, New Hampshire. So for this project, I focused on Congresswoman Maggie Goodlander, who represents New Hampshire's 2nd District. So you see on the map here, it's mostly the western portion of the state. Since taking office in 2024, last year, Representative Goodlander has prioritized several public health issues such as the opioid epidemic, mental health, cancer. So given this leadership and experience in public health advocacy, it is important to include bioterrorism and overall public health emergency preparedness. And to dive deeper in what this could look like, we'll look at 2 current concerns within this district. So looking at concern number 1, although New Hampshire is geographically rural, actually most of its population lives in concentrated areas such as Nashua and Concord, cities like those. But however, many surrounding rural jurisdictions don't receive the same level of attention and resources for public health preparedness as those larger areas. And this unequal distribution of funding and infrastructure can create gaps in disease surveillance and emergency response capabilities, meaning smaller communities might not be aware of an outbreak until it has already spread. And in the event of a bioterrorism attack, that delay could be very critical. So a pathogen could circulate silently within a community before reaching more densely populated areas, which will just increase illness and death. So while larger cities are often the most likely bioterrorism targets, rural regions should not be overlooked. Not addressing this concern could allow attackers to test these agents for smaller social or agricultural disruption, allowing them to assess the usefulness of the agent without immediate detection. The second concern relates to the foreign ownership of critical infrastructure in New Hampshire. So earlier this summer, a Chinese-owned beverage company purchased 23 acres and a 300,000 square foot warehouse in Nashua, New Hampshire for $67 million, which was actually 4 times over its listed value. And what makes this case sensitive is the location of where this property is. It sits right next to the Pennachuck water system, which is Nashua's primary drinking water supply, and it's just minutes away from infrastructure such as military bases and air traffic control. So to emphasize, while there's no confirmed threat or evidence of any malicious intent, the lack of transparency and response from public officials, combined with the national concern and attention this story has gotten, it should be addressed. So from a bioterrorism preparedness perspective, even the remote possibility of intentional water contamination, it obviously poses a serious national security concern and community health risks. But also the focus of this concern will not suggest malicious intent by the company. Instead, this incident will be used as an example of how misinformation and public panic can amplify perceived threats, emphasizing the need for greater public health emergency preparedness frameworks. So my first recommendation is to strengthen rural bioterrorism and pandemic preparedness through joint federal and state funding mechanisms. One example of this is FEMA's Emergency Management Performance Grant, which supports state and local governments in implementing the National Preparedness System. So this program helps fund activities across all phases, including prevention, protection, mitigation, responses, and recovery. And despite the grant's $319.5 million in national funding in 2025, the distribution often favors those more larger and populated areas. So this leaves smaller rural places like New Hampshire very under-resourced. And to address this, Congresswoman Goodlander, she could advocate for dedicated rural preparedness funding pathways. This would ensure New Hampshire, especially rural New Hampshire, has the resources to modernize surveillance systems and enhance their ability to detect and respond to bioterrorism threats. For recommendation number 2, the initial responses by healthcare and public health after a bioterrorism event, they often determine whether an outbreak is contained or spread across regions. And unfortunately, many of these staff lack trained personnel needed to recognize the unusual disease patterns, especially in those rural areas where staffing may already be limited. This was very evident during the COVID-19 pandemic, where rural healthcare workers faced overwhelming workloads and were not able to meet those demands. So, to improve this, Congresswoman Goodlander can advocate for rural health systems and departments to conduct regular joint preparedness drills that simulate bioterrorism attacks together. This would bring together clinicians, public health workers, emergency responders, any other partner to practice coordinated detection and response strategies. And then training together, this will allow rural areas to strengthen their shared detection, coordination, communication skills, and just shared decision making. And now the final recommendation we have for the first concern is to address the lack of consistent disease reporting and surveillance systems in these rural areas. So smaller populations often means less data is collected, making those unusual disease patterns more difficult to detect. If someone wants to remain hidden, rural areas like these will allow an easier entry point for an outbreak, and it might not be recognized immediately. So to address this, I recommend that rural healthcare facilities and labs adopt a shared disease detection and reporting system. That way, when data is shared across these communities and partners, it becomes a lot easier to identify patterns that would otherwise go undetected just in isolated jurisdiction where they're just keeping that data to themselves. So next, I'll transition into two recommendations for the second concern in New Hampshire. So the Committee of Foreign Investment in the United States, they are responsible for reviewing certain foreign investments and transactions that may pose national security risks. The recent purchase of land in Nashua has exposed potential weaknesses in these safeguards, as well as fueled public concern that the committee's oversight might not be enough and they might not have enough power. So in response to this, both New Hampshire representatives actually introduced the Critical Infrastructure Security Act just a few weeks ago in September. And what this act would do, it would require the committee to annually review and update its list of sensitive properties, enhance its investigative powers, and be able to block any transactions that pose this risk. So we recommend this bill be supported in a bipartisan way and make its way to federal law. Now, recommendation number 5. One of the biggest lessons learned from these events was just how quickly public health misinformation can be spread. The widespread media coverage and public panic that followed revealed a critical gap. Local government and health officials, they really struggled to communicate effectively in a way that calmed the public and gave them the right information. And even in a situation like this where there is no confirmed threat, nothing has taken place, a lack of transparent communication can really shake the public, which can make it difficult for officials to manage real emergencies in the future. So to strengthen community confidence and response capabilities, I recommend local and state agencies adopt the CDC's Crisis and Emergency Risk Communication Framework. These principles emphasize timeliness, accuracy, empathy, and credibility, which are all important factors when addressing public fear. Training emergency management officials in these strategies would ensure they're better equipped to navigate any rumors and respond clearly to them while maintaining community trust during actual public health events. So our response strategy, together combining all these recommendations, it forms a comprehensive response strategy aimed at strengthening New Hampshire's overall bioterrorism and public health emergency preparedness. For rural areas, combining equitable funding, joint preparation exercises, and informed surveillance systems creates a comprehensive framework across neighboring jurisdictions. And at the same time, addressing public concern over foreign ownership near critical infrastructure, it highlights the importance of treating bioterrorism and pandemic preparedness as national security priorities. So Congresswoman Goodlander, she can really be a key player in advancing both policy and on the ground readiness by advocating for dedicated rural funding, supporting federal oversight expansion, and promoting consistent communication among all public agencies. So there are two challenges that could affect the implementation of these recommendations. First, gaining buy-in from local health systems and stakeholders can be difficult, as we all know. These hospitals and departments, they face competing priorities, which can create resistance to participating in additional preparedness activities. So to address this, these stakeholders should be engaged early throughout the planning process. Congresswoman Goodlander and others involved should clearly communicate the benefits of these interventions, why we're doing them, such as improved regional readiness and greater access to grant funding. The second anticipated challenge, many rural New Hampshire communities lack wastewater surveillance because they rely on private wells. They don't have that public access to water like most cities do. So this really limits early detection capabilities for infectious disease outbreaks. And to address this, we're just going to rely on other detection methods. Shared syndromic surveillance and data reporting could be expanded, touching upon the recommendation I had earlier where these labs and these hospital systems, they really rely on sharing data with each other to make sure no unusual symptoms or diseases go unnoticed. So as seen over the last couple of years, the world is a vulnerable place to natural and intentional disease outbreaks. The greatest time for bioterrorism and preparedness and pandemic preparedness, it's now and not before or when the crisis actually emerges. So investing in research and innovation, medical countermeasure production, enhanced disease surveillance, frontline workforce readiness, reliable and accurate communication methods. By doing all these, we can strengthen New Hampshire's and the nation's readiness for bioterrorism events or any pandemic preparedness events. Thank you very much. If you have any questions, feel free to reach out to me.